Today we will be talking about vomiting in children. Vomiting is the retrograde flow of food contents or fluid from the stomach back into the esophagus and the mouth. Vomiting is taken as a very common thing day in and day out by parents, and that is exactly what it should be as well, because there may be multiple medical causes of vomit like gastroenteritis, food poisoning, etc. etc. But we will not be discussing the medical causes of vomiting today. We will be discussing what are the surgical causes which may have the child to vomit again and again. The first thing that parents need to be aware in a child who is vomiting is what is the color of the vomit. If the child is vomiting yellow or green, that is what is called a bilious vomit. This vomit needs to be dealt with a lot of caution. If the child is a neonate, that is, a child is less than 1 month old, and the child is vomiting green bile, then this needs to be immediately consulted by a pediatric surgeon. One of the most common causes of green vomiting in a neonate is malrotation. That is, an abnormally placed intestines inside the child's stomach which causes these intestines to twist. This is called malrotation. The twisting may cause impedance of the blood supply to the entire intestine, and if proper care is not taken, then the blood supply to the entire small intestine may be blocked and they may become gangrenous. The other causes of green vomiting in the child is any obstruction inside the intestine. So, a pediatric surgeon would always investigate the child with X-rays, ultrasound scans, and if need be a CT scan, and then further treatment. It could be medical management or it could be an operation which would be required for the child. The next would be white vomits. White vomiting is not taken very seriously by most parents. But if the child is persistently having white vomiting with weight loss, then this needs to be taken seriously. When the child is 1 month old and starts to vomit white colored fluid, and that too propulsive vomit, like in an adult who is doing gargles, then a suspicion of pyloric stenosis should be made. Pyloric stenosis is a blockade on the exit point of the stomach, which is called the pylorus. The muscles here get hypertrophied and hence cause obstruction. Diagnosis can be easily done by an ultrasound scan, and a simple surgery, which can also be done laparoscopically, cures this problem. The other common cause of white vomit is gastroesophageal reflux, that is, retrograde flow of the food contents from the stomach into the esophagus. This normally settles down on its own by the age of 2 years, and doctors mainly give supportive medicines for a child who is having gastroesophageal reflux. However, if gastroesophageal reflux is causing the child to have recurrent pneumonitis, poor weight gain, and failure to thrive, then early treatment in the form of surgery may be required.